All right, hi. Welcome to our beginning video for this course in the Introduction to Professional Counseling. What I'd like to do is to go over a number of the different types of helpers that we have and the various disciplines and how they work together and the differences there, and give you kind of a view of all the different kinds of helping relationships that we have with other organizations and those kinds of things. So if you bear with me, what I'd like to do is just go through some of this information here and give you some lecture material and ask you to pay attention to this at the very end. You know, I've been a licensed counselor now for quite a while, and one of the things that I had to decide on very early was whether or not I really wanted to be a professional helper or get into psychology or mental health. And it seemed to me that I really had to do some soul searching about whether or not this was going to be the field for me. This was a rewarding field that I really wanted to spend my time in and build a career in over a long period of time. You know, there's a basic question too, is really, am I interested in other people, and am I in a place where I feel okay enough about myself and my background and my family and my prospects and my relationships that I can also go out beyond that and help others. So I think the basic question is, are you really interested in helping others? And what does that mean to you? So when you think about it, yeah, sometimes people come to you and they say, you know, I've got this problem, let me tell you about it, and they may want to ask for advice or have you kind of give them what they should do, tell them what they should do. But that's a very different scenario than becoming a professional helper, when, you know, telling someone not what to do is really not what counselors actually do in their work. They're really guiding people and helping them find their own answers to things, but it takes a lot of training to get to that point. So at the very beginning, you really have to decide if you're interested in people, if you really like to work with and help other people out. And another question, what is the reward for you? What do you get out of this that will make you continue to be into this business? What about your personality that will allow you to sit and listen and really attend to what another person is saying about things that they're going through in their lives? Wow, I tell you, that's not for everybody, because what happens in those kinds of situations, sometimes people are, as they begin to tell their story to you, you begin to think of your own situation, your own issues, and sometimes the very first thing happens when you don't have training is that you want to tell them what to do, or you begin to think about your own issues, and then you begin to kind of drift away from your original intent. So I think there is a helping personality there. I think there has to be that in place for people who want to come into this business. There's a lot of different ways to go about it, but I think it really begins with you having to think through and what this will mean. When I mentioned benefits a minute ago, I think there's a lot of rewards in the helping field, other than just having a good career and having a job and income and those kind of things. I think there's something rewarding for each of the individuals in the helping field. I think you get back a lot in helping others. I think there's a lot of return on investment when you're really giving of yourself to help another person. It's quite rewarding. It's a very rewarding field, much more so than the monetary gains or the status and so forth that people who are in this field have, because I think there's something enriching in our own lives when we reach out to help another person who's struggling. And when you think about those kinds of things, I think it's important that if you're thinking about this line, that you pay attention to that and kind of really do some soul searching about that and talk with others. You know, when I've asked people who are coming into counseling in our training program here at Columbus State and our master, I've been told that I'm a good listener. And they will hear that from different people. They may have heard it from their parents. They may have heard it from their friends and peers and colleagues and so forth. And it may be very true that they have the ability to really attend And we're going to talk a lot about that in the coming chapters. But I think the issue there is that is a great start. That is a very important place to be and have that particular gift and that kind of skill. To have people say that you are a good listener, because what it means is that you have done something in that process to make that other person aware that they're being heard, they're being listened to. And sometimes that can be one of the most important things that happen when people are under stress or going through difficulties, that they have someone that truly listens. Not give advice, not really telling them what to do or coming up with some important intervention or some kind of technique, for counseling technique that might help them, but really just to attend and to be there. And for a lot of situations, and there's one, I can mention that there's one theory that we'll take a look at here later on, where the writer, the author of that theory says that really, if you are really attending and you're getting into that person's world and really empathically understanding and trying hard to listen and be with them as they tell the story, that in itself becomes therapeutic. Now that's pretty impressive, that just by listening and doing these things that really convey the importance of the other person's story and how much you're attending to it can be therapeutic. But it seems to be very true. Now there's more than that in terms of a therapeutic relationship and really helping, but I have to say that those people who have those attending skills, those abilities to show empathy, and really attend and not give advice, but just begin to allow that person to talk, will really do well in the helping fields. I just mentioned empathy, and we're going to talk about several terms, and the terms to know later on. You're going to hear and see some of those terms that I think are very important as we define those and moving in. You'll probably hear them over a period of time. But I think it's very important that at first, as you really begin to think about this, that it is a commitment. It is a challenge, and it is a commitment for someone to say, hey, I want to be a professional helper. I want to move into mental health, community agency counseling, or school counseling, and marriage and family therapy. I really think I have what it takes to do that. And that starts with that ability to really be interested and to be able to listen to people. I want to spend just a moment here and talk about a few things that will come up as we overview and really take a look at what counseling is and look at the context of counseling. And so, if you will, I'm going to just and go through some of the things that I think are important. Later on in the textbook, this is Gladding's book. I don't know if you can see it very well on the screen, but this is our Counseling, A Comprehensive Profession by Samuel Gladding. That is our textbook for. We're going to spend quite a bit of time going through that, and we'll start out looking at the historical context of counseling. We'll look at how the different disciplines work in professional helping and so forth. And so let me just start here by talking a little bit about the idea of human services, because I think it's important that we understand that there are different approaches to helping, and the disciplines, and you may have heard and be familiar with some of these, but there's a medical doctor, a psychiatrist who is a medical doctor, who has got training in psychotherapy and psychopharmacology and is a medical doctor and prescribe medicine and so forth, who is also considered a professional helper. They go to medical school for that. There's a psychologist who also gets their doctorate degree, who typically works with people in a practice or in teaching as well, who was licensed as a psychologist. They're not at this point prescribing medicine or pharmaceuticals, but they do a lot of work with people. They also, if you know this, the psychologists do a lot of assessment and testing. So not only do they do the psychotherapy work, but they may do, you may find psychologists in a number of organizations in administrative roles, in organizational psychology, in industrial psychology, clinical and counseling psychology, and so forth. So I think we have that group. Then there's the professional counselors, those people who mainly get a master's degree and go out and help in the field. And so they're working in agencies and hospitals and clinics and in private practice to help others with psychotherapy. Typically, it requires a license, just as the license for the psychiatrist and psychologist. It requires a license in the state that the person is operating on, or they practice. There's licensing laws that we'll talk about later. But it's interesting to note that most of the psychotherapy and the counseling efforts out there are done by master's level clinicians and master's level helpers. So it's important to know that these are licensed people who are well trained and well educated in order to help other people, and that's another discipline. There are clinical social workers. These are people who have masters in clinical social work and years of experience, and they're also licensed within the state they operate in, and they can provide very similar kinds of psychotherapy and counseling work for individuals, marriages, families, and so forth. You also see marriage and family therapists. These are licensed people as well in the same vein, and their focus is on family systems, and so they don't just work with the individual, but they actually work with the family systems in order to affect change in the larger systems. There are a number of other disciplines out there, but those are some of those that I think really are important as we look at this. In a lot of situations, you'll see that there are multidisciplinary teams where therapists who are professional counselors, marriage family therapists, psychiatrists, psychologists, working together in clinics and in hospital as a multidisciplinary team in order to affect change in people. So having said that, those are the different kinds of disciplines I think that are important. You can work in a number of different agencies. I mentioned hospitals and clinics and private practice, but there are also both outpatient clinics, those that people who go visit, say once a week, counseling appointments. Typically a counseling appointment may be 50 minutes or an hour, and they're seen once a week, and they're seen over a period of time. A lot of the literature points to the notion that counseling sessions typically run from 6 to 8 sessions across nationwide, so that these are not long-term extended kinds of treatment programs, but generally speaking in an outpatient program where an individual or family, couple, child in the family come to a clinic once a week, generally speaking, for psychotherapy. The job of the counselor in that particular situation is to assess the incoming problem, or what we term the presenting problem, and those are the things that the client tells the therapist what is bothering them, and those kinds of issues, the reason that they're coming in. The job of the therapist then is to assess and get that information and put that into their thinking so that they come up with a treatment approach using one of the various theories that we'll talk about later, and come up with a treatment plan. The treatment plan really is a document that is charted and is kept in a chart, so that people, the therapist, can, through the course of the therapy, document the progress of the client and keep on track. Generally speaking, the treatment plan includes goals, so that we know and the client know why they're coming in and what their purpose is there, and that so that the conversations and the discussions and the work in the therapy is related to the goals that are in the treatment plan. So at the end of that, there's a termination, and the client and therapist typically agree about the termination, that the work is done, and can kind of move from there. So that's the outpatient scenario. Now, when there are more severe problems, perhaps a client, an individual, a family member may need to go into a hospital that will, a safe environment for them because of a particular mental disorder or other kind of challenge in their lives, and they need a more secure environment. So I think in the hospital clinics and what we call inpatient is that these people go in and for the most part are secured in that facility for a period of time, generally a short period of time, but they get rather intensive treatment. Like I mentioned, the multidisciplinary treatment teams come in. The psychiatrists there may be prescribed medicine and monitored for that. They may have family and individual and group psychotherapy during that time. They again have a treatment plan just like outpatient clinics, and then therefore they are released at a point where they are getting better with their symptoms and so forth. So we have both outpatient and we have inpatient treatment approaches there, and I think it's important to note that some of the training will lead you in either of those directions. Generally speaking, training in the helping fields will prepare people for dealing with a range of psychiatric or mental health disorders, ranging from very mild and sometimes what is known as adjustment issues, where we're just adjusting to changes in our normal everyday development in our lives, or something that's come in our lives and we're having to adjust to it. It might be loss of a loved one, or grief in that respect, or change in something in our lives, versus those that are much more severe, where there are things that are severe mental disorders like schizophrenia or more obsessive compulsive and personality disorders and those kinds of things. So trainers are aware that they have to train people now to look at a wide variety, a wide scope of mental health problems, and I think that's one of the things that we'll continue to look at. I know there's a particular classification system that we'll look at called the DSM-4 a little later on in the course. It goes over the classification of mental disorders, and I think that'll be helpful for you to get a view of that. Let me take just a moment and talk about what counseling is, and give you a couple ideas. It's really the treatment of these interpersonal and intrapersonal, meaning inside within the person, as opposed to the relationships and those issues that are between people. So I think it's becoming more and more common to find people talking about the use of counseling in their lives. You see more and more people going to counselors, and I think that's a good thing. I think it's probably sometimes more worrisome when people do not go to counseling that need to. So there is a stigma about going to counseling. A stigma meaning that, you know, there are some people who see that as a sign of weakness, or that you can't manage your own problems and so forth. But I have to tell you, that is a myth, and that stereotype is being broken these days, because we're in a very complex world. It's a very difficult world to manage in. There are more and more difficulties that we're facing that we have never seen before. And so I think it's a sign of health when people realize that potentially I can go talk to someone and get a different viewpoint and have a place to let out some of those anxieties and depression and other kinds of things that maybe I'm dealing with, in order to feel better and to move and be productive in life. I think what happens is that the counseling relationship that is developed between a client and a counselor, the purpose of that would be really to help the functioning of the person coming in. That can be defined in many ways, but not just feeling better, but thinking better and doing better as well. So let me just read a couple of things from, this is a textbook that I use as adjunct here. Why counseling is the question, and here's a little, if you will bear with me, just let me read this particular portion here. The question is, why counseling? It may be necessary to remind some aspiring counselors that the problems of life can be solved in many ways, counseling being only one of the ways. The vast majority of the human race has never experienced personal counseling. Does that mean that they are functioning at some sub-level of life? Of course not. Many people adapt to life's challenges using personal resources, friends and family and religious faith. But even with these resources, challenges can sometimes accumulate to the point that these resources, to the point that they can be encumbered, and a skilled helper can facilitate the growth and adaptation of those challenges. Viewed in this way, counseling can assume the function of change, prevention, or life enhancement. As change, people are concerned with situations that, for whatever reason, have become so disruptive that they're unable to continue through the normal passage of life without excess stress, dissatisfaction, or unhappiness. As prevention, counseling is able to take into account those predictable life events that produce stress, cause people to draw on their psychological resources, and ultimately demand adaptation to changing life forces. And finally, there's a third form of counseling, enhancement counseling, that goes beyond life's challenges and predictabilities. As a counseling goal, enhancement attempts to open clients' experiences to new and deeper levels of understanding, appreciation, and wisdom about life's many potentialities. So you can see from that there are some people who are just who are coming into counseling really in order to change something that's not going well. They want something different in their lives. And a counselor will help make a plan, devise a treatment plan for that change to occur. Now they have to use their objectivity and their expertise to help a person in that with that challenge. But the focus then is to change something that's not working well. The second notion was prevention, and that is to build on the resources and to really adapt to things that are coming. So being prepared for the interpersonal and intrapersonal challenges that one has. And then finally, this enhancement counseling is really when things are going okay, but we really just want to talk to someone different, someone new, someone who's objective about their view of us and can give us feedback about enjoying life more, making things better, kind of fine-tuning things that are generally going okay. So I like to think that those three areas are really kind of helpful in helping you to kind of see that counseling is just not about a problem-focused, and we have to do these things to get someone through a particular problem. Well, I want to read a couple more things here, and then we'll go to episode 2 coming up. So if you'll bear with me, I want to say that we're going to talk about some of the counseling theories and approaches of how counselors actually help a client change coming up. We're going to spend quite a bit of that in the helping section and in the therapy section, and look at therapy and really get familiar with what a counselor does in that and how they use theories. But let me just say that I want to read a list of 7 elements about counseling, and these are things that are operative in all counseling across the various theories. When we talk about theories, you'll learn that some of those theories talk about things out of the past, some of them talk about things in the current, some of them talk about things in the future, some of them connect all of those. But what I wanted to show you right now, or read to you and present to you, is 7 elements that are working in counseling throughout. Okay, so here we go. Number 1, counseling involves responding to the feelings, thoughts, and actions of the client. Thinking of this in another way, the counselor deals with both attitudes and behaviors of the client. Existing theoretical approaches differ with respect to the emphasis and the order of responding to feelings and behavior. So what you'll see is that some of the theories may spend more time on emotions, some may in feelings, some may be on the behavioral change, things you have to do. Now, here's number 2. Counseling involves a basic acceptance of the client's perceptions and feelings regardless of outside evaluative standards. In other words, you must first acknowledge who the client is before you can begin to consider who the client might become. Clients need your understanding of their current situations and concerns before they anticipate growth and change in a new direction. Number 3, confidentiality and privacy constitute essential ingredients to the counseling setting. These two terms, this notion of confidentiality and privacy, must be upheld, and you have a sworn duty to do that as a counselor. Number 4, counseling is voluntary. Ordinarily, it is not effective when it is something that the client is required to do. So regardless of how the client is referred to the counselor never uses coercion as a means of obtaining or continuing with a client. Number 5, generally speaking, the counselor operates with a conservative bias against communicating to the client detailed information about his or her own life. Although there are times when counselors do self-disclose when it's appropriate, counselors generally do not complicate the interview by focusing attention on themselves. Number 6, one skill underlying all systems of counseling is that of communication. Counselors and clients alike continually transmit and receive verbal and nonverbal messages during the interview process. Therefore, awareness of and sensitivity to the kinds of messages being communicated is an important prerequisite for counselor effectiveness. And finally, number 7, counseling is, at minimum, a cross-cultural experience and probably a multicultural experience. Now, those are 7 common factors and elements across all of the counseling approaches and theories that we'll take a look at later. So why don't we stop here and allow you to take a look at some of the questions and also move on to episode 2. Thanks for viewing.